we're going to do a demonstration today on how to draw blood from a triple lumen catheter. This video is not intended to be a study aid for lab testing. For specific questions regarding lab testing, please consult the critical elements. So the equipment that we need for this procedure is gloves. We need a vacutator holder. We need a blue needle. We need alcohol pads. We need 2 10 ml pre-filled syringes. We need a biohazard bag. And we need our tubes. So if we're going to draw 2 tubes of blood, we need to actually draw 3 because the first one is going to be a waste. Okay, so we're going to wash my hands. We're going to go into the room. We're going to check the wristband, identify the patient with 2 forms of ID, name and date of birth, and then explain the procedures to the patient. And the port we're going to use is the proximal port. If you're ever confused on which one the proximal port is, they all say right on there. It says proximal here, medial, and distal. And no matter what company you use, they'll all say the same thing on there. So the first thing I like to do is to set my equipment up. So I'm going to take my vacutainer and my blue vacutainer needle. I'm going to disconnect it. And the way that they go together is just like that. Okay. And then the next thing I'm going to do is I'm going to put on my clean gloves. Now if I had an IV running in here, I would turn the IV off for at least 60 seconds. And then I could draw the blood from there. But I don't have any blood going through here. All my pigtails are clamped off and they're ready to go. So what I'm going to do first is I'm going to clean the port and then I'm going to flush it with normal saline. So I'm going to take my normal saline and I'm going to get my alcohol pad. I'm going to fill my proximal port. I'm going to clean with alcohol. And then I'm going to attach my syringe. And then I'm going to unclamp. And now I'm going to flush it with full 10 cc's of normal saline. Before I disconnect it, I'm going to clamp it again so I don't give the patient a PE. Disconnect it. And then I'm going to take my vacutainer and I'm going to attach it right to the vacutainer, or to the pigtail. Unclamp it. Take my first tube, which is going to be my waist, and I'm going to fill it up. Fill it up as far as it goes. And then I'm going to dispose of it in the sharps container so I don't get confused on which one's my waist. Some people like to put a big W on here. That way they know it's the waist. Then I take my second tube and I fill her up as far as it goes. And then I take my third tube and I fill it up as far as it goes. Now before I disconnect this, I need to reclamp. Disconnect, take my second flush, and then flush it again. Unclamp, and then flush it with 10 mLs of normal saline. Before I remove this, I'm going to clamp it again. Disconnect this. Now if I had IV fluid running, I can reattach the IV fluid, unclamp it, and then start running it again. Okay, so I'm going to put on my tubes my name, date, time, and initials on here. And then do that. And then do that. And then I will put it in the biohazard bag. And I will send it to the lab. Alright. You have 15 minutes in your lab testing to complete this. You shouldn't need all that time though. Okay, thank you.